Hi, we are in the first case today. We have nose reconstruction. It's a consequences of injury that she had when she was a little kid. So she had a necrosis of all the middle part of the columnela. So she doesn't have skin or columella at all. So we'll have to take a piece of the ear as a composited graft and put it there for only reconstructive purposes. So we'll see how this works, and we'll see without any noticeable scar at the end, because we will close primarily the ear and we'll put that piece of skin and cartilage to reconstruct the middle part of the nose.
To hold you close, and all your fears that you dream of will disappear and flutter out. Oh, hold on just a little, we'll meet right here in the middle.
Okay, so we finished here. You can see where we started that she had this part of her nose missing, the columella. So what we did, I think, is a pretty elegant solution, is took this piece of cartilage from the ear. That closes primarily. She'll never notice that that's gone, essentially. Then transplanted that with the cartilage in the skin to the nose. And so that's reconstructed the columellar subunit, we call it. And then this will heal in as a free graft. So pretty elegant solution. We'll see how she heals, and hopefully this does the trick for her. So pleasure to work with Dr. Restrepo, Dr. Herrera, real experts in pediatric facial reconstruction, and work with pre-care kids to help these kids and their families.